From Studio 226 in Orlando, this is Aging Smarter. Aging Smarter is a podcast focusing on making it easier to grow older and to prepare for the future at any age. We aim to educate, entertain, prepare, and amaze you about your life's journey, regardless of your age. I'm your host, retired and former circuit judge, Jose Rodriguez. Now, we have an interesting individual that we have invited here to tell us about a program named Shine. Now, there's always the ability to lose your shine, but we're not going to do that. This is all about Shine, and we have Elisabeth Hall, who is a Shine volunteer counsel. Ms. Hall, let's begin by telling us a little bit about yourself. Who are you?
Well, thanks, Judge. I am, as you said, a Shine volunteer, but I have lived in Florida and Orlando for over 50 years, and 37 of those in Orlando, working in the travel, tourism, and hospitality industry.
So you know Orlando back and forth and inside out.
And it's become my community, yes. And I decided to retire in October of 2020, and prior to
Just yesterday.
Just yesterday. And when I thought about retiring, I started to try to figure out Medicare. I spent a good year and a half and wasn't really reaching out to the right people. Made a decision finally because it can be very confusing.
It can.
And when I retired, I went to what I knew, who my friends, family had used. During retirement, I knew I wanted to volunteer because while I did volunteer committee work for the state and the city and different organizations. And I wanted something that would have a lot of new training for me, keep me involved with my community. And one day I was looking on LinkedIn and saw a posting by Senior Resource Alliance,
Oh, yes.
which you had Carla here
Yes.
the other day.
Our friend.
Your friend, and I went and joined a class and realized how little I knew about Medicare.
And I will tell you, my wife and I are both Medicare beneficiaries as well. And it can be quite a task. I mean, even with a law degree, it's quite a mountain climb. So completely understood. But how does Shine work with Medicare? Tell us a little bit about that Medicare network around the state that Shine works.
Well, the SHINE program is part of a nationwide senior health insurance program, assistance program here in the United States. And there are in all 50 states, there are SHIP programs. And there are
SHIP meaning state health insurance program.
Assistance program. And also in our territories, the 4 territories. In Florida, we call the program SHINE. Each SHIP program serves the same function, providing free, unbiased counseling on Medicare and related health insurance topics.
So it's not like those people that cold call you and say, "Oh, are you a beneficiary? Do you qualify for Medicare? And tell us how old you are." No, I'm not going to tell you how old I am. So that's not Shine.
It's not Shine. Shine does not solicit or call clients. The clients initiate the call to our 1-800-863-5337 number.
Okay, let's give the folks that number again.
Okay, 1-800-963-5337 or 1-800-96-ELDER.
And we're going to post that later on.
Right. And once they call that number, then the call center, our call center specialist will take their information and assign it to a local volunteer to contact that individual, not before they initiate the call to us. And then what I do when I get a call is I will send an email or a text to that individual with all of my information so that when I do reach out to them, they know, and I tell them when I'm going to reach out to them, they know who I am or how to contact me.
It's basically verified that you are who you say you are and that you're not basically just cold calling them and trying to solicit business. It's
No,
something that they have initially initiated.
exactly.
Initially initiated? Yeah, there you go. Not
So
only that, but you started it. They've started it themselves.
they did, and they would reach out to us. Yes, absolutely.
So tell me, what role does the Florida Department of Elder Affairs play in the program? Because I understand it is a statewide program.
It is Shine is a statewide program for Florida, and then the SHIP programs are nationwide. So the Department of Elder Affairs gets a grant from the federal government, and
Okay.
they then disperse that grant to 11 area agencies that which Senior Resource
Are
Alliance
those
is
the
one of
area
them.
agencies
Seas
on
of
aging?
Aging,
Ah,
yes. And Senior Resource Alliance is the agency that we have here in Central Florida.
well, from my perspective, from what I'm gathering from you, is that that is a great way for there to be accountability.
Yes, so there's agreements between the area agencies of aging and the Department of Elder Affairs um, within the state of Florida. And there are 11 different area agencies of aging. Here in Central Florida, we're PSA 7.
We're number 7, lucky number
Yes,
7.
lucky number 7. And we cover Orange, Osceola, Seminole, and Brevard counties.
Those are the areas that the area agency on agency or an aging Senior Resource Alliance covers.
Exactly, exactly.
The Quad County area.
Quad County area.
So tell me more. Tell me more about how Shine, in collaboration with the AAA, reaches out.
So the Department of Elder Affairs, with their contracts, um, they reach out through different, very robust uh, outreach programs, and also through this counseling. The We're at trade fairs, we go to health fairs, we work with different partners in the area to reach out to the people who need the information that we provide.
I see. So again, it's not just here it is, you give us your info, we'll call you, we'll send you the information to verify who we are when we call you, but you actually go out. And when there are fairs and information fairs and the like, you try to reach them out individually,
We
personally.
actively want our community to know that our services are available. We work with other community partners. We also do counseling at some of our other partners. We work with the public libraries, the YMCA, so that an individual may find it easier to come there to get counseling than to the actual Shine office or over the phone if they don't want counseling over the phone.
So in a way, what I hear that you are doing is you're helping somebody climb that Mount Everest and making it easier to access Medicare.
Yes.
So who's eligible then?
So anybody who is 65 years of age,
Count me in.
a Medicare individual, when you're 65, you'll get a letter from Social Security, and they'll say, oh, you're eligible for Part A Medicare and Part B Medicare. Now, there are some, you have to be a U.S. citizen, and there are certain um, options available to you if you don't meet specifically the 65 and the U.S. citizenship. So if you are a resident, uh,
Resident alien.
alien,
A green card is what we
green
call
card
it.
holder,
Which are really no longer green. They're kind of bluish from what I hear.
for at least 5 years, then
Uh-huh.
you can be eligible. And then there is also the eligibility with the if you're under 64, if you have certain disabilities or ALS or
That's also known as Lou Gehrig's
Lou
disease
Gehrig's disease or
because the real name is unpronounceable. I'm not,
amyotrophic.
I'm not even going to try it.
Yeah, so that and if you have end-stage renal disease, and that would be that you're on your
Dialysis?
dialysis on a regular basis, or you get in line for a kidney transplant. And then you can get that those are options that exist or exceptions that
Where
exist.
you don't necessarily meet the 65, but
Exactly.
yeah. Yeah, that's rough, but hey, thank goodness, that there is a an exception there or an
Right.
exemption. So, what else does Shine we're talking about a volunteer group. Tell me how you go about, um, recruiting and what qualifications do they need to have to be effective? And, of course, I suspect you get a lot of training.
Yes.
I
So,
mean, because you're talking about some complex programs, it stands to reason that you would be trained right, left, A, B, C, D, E, all the way to X, Y, Z.
well, you have your initial training, but you also have continuous changes
Ah,
because Medicare is
sure,
continuously changing.
sure. It's a dynamic beneficiary program.
Exactly. And in Florida, there's over 400 Shine volunteers
Oh, wow.
throughout Florida. And there are dedicated individuals who what they want to work with diverse people. They have the ability to work with diverse people like in our community.
Sure. I mean,
They
Florida has a Haitian community. I mean, even here in Central Florida, in Osceola County, we have a very thriving Puerto Rican community in Point Siena, all over. I mean, Miami, well, we call an area of Miami Little Havana. We are a very diverse population.
yes, and we with that
So the needs and the perceptions of the programs might also be different.
different, and that's why a Shine volunteer needs to be a problem solver. And they need to know how they want to be helpers. They want to find the answer for the person they're working with. So they do need the ability to use the internet and other resources to research programs that may benefit their client. They have to have good communication and interpersonal skills, and they are unbiased. They have to be unbiased.
How do we know that someone's being unbiased? What do we teach them in the program on how to demonstrate that they're unbiased?
Well, first of all, you're listening to your client. You're listening to what they need because everyone needs something different. Medicare is not a one size fits all.
Awesome.
So you listen to them, you provide them the information that is available between the different types of Medicare, and you help explain to them how it works and how it may affect them with their different needs. We then let them make the decision.
I see.
So,
In other words, what coverage they may want.
what coverage they may want, or how they want to, if they have other questions, where what's going to affect them, what's going to be the thing that makes a difference to them if they were to take a different type of Medicare.
I suspect from my own experience that sometimes there are programs that may cost different for folks to join in.
So, Medicare A and B are the original Medicare. And Medicare A covers the hospitalization.
Right.
Medicare B covers your
Doctors.
doctors and durable medical equipment and some treatment, x-rays, things like that. Then there's Medicare Part C, which is a Medicare Advantage plan.
Right.
So in the United States, as of December of last year, CMS, Center for Medicare Services, they said there are over 68.7 million people on Medicare.
That's a lot.
Yes, and here in Florida, there's over
68
5 million.
million
Yes,
and 5 million in Florida alone. You know,
exactly.
I read that the last decennial census told us that there was 10,000 individuals a day growing to be 68. I'm sorry,
60,
65. So 65 10,000 people a day that qualify for Medicare. That's a lot.
It's a lot of people, and a lot of people who don't know where to turn to
Right.
find the answers. So
Scaling
that's why
Mount
we're there.
Everest.
Exactly. So of the current population, about 50% are on original Medicare and 50% are on the Medicare Advantage plans. Then there's also your prescription drug plans
Right.
that you need to know about and the Medicare supplements. Those are used if you take Medicare A and B, you get Medicare D, which is your prescription
Right.
drugs. And then you have an option if you want something that will cover all of those copays and coinsurance that aren't covered by original Medicare, you can opt to buy through a private insurance company a Medicare supplement plan.
And it supplements what you are basically getting from the government that you've earned as a beneficiary.
Correct. It pays those costs that aren't being covered.
It makes sense.
Yes, and the Medicare Advantage plans, they cover Medicare A and B, hospital and doctor, but they also have Medicare Part D prescription coverage, and they offer many times, many of the plans will offer vision,
And
dental,
dental.
and hearing benefits as well. So they'll offer some extra benefits.
So tell me, could you give us some examples about the types of support that Shine volunteers provide to seniors, especially when it comes to understanding those services?
Sure. It's once we find out where they are, what they need, because in addition to the services that I talked about, we also do low income subsidies, preparation for people who may need assistance with their drug prescriptions. So we want to know where's their big need? How do we help them with that? And there are programs available for them to that. And we also have a Medicare savings plan that helps pay some of the premiums, the Part B premiums. So we want to find out what they're doing, what they need, and then we will explain their Medicare options to them.
I see. I
Now,
see.
when we provide plan comparisons, they can see right away
What they get
what
for
they
how
get
much.
and how it's going to affect them.
You know, it
Yes.
makes sense. You make it obvious, you make it visible, you make it real.
Yes. And that helps to clarify everything because when you're trying to read about it or you're getting a lot of calls from people about Medicare, it can get very confusing very quickly.
Well, I wish I had known about Shine when I was signing up instead of having to find it out all myself. You really do angelic work. Um, so tell me, um,
In a well,
what else?
so in addition to that, we do explain the paperwork because there's paperwork or online and how to sign up for Medicare.gov, which is a great site that people can go on once they have their Medicare number, and then they have access information
They
for
better
them to
remember
use.
their password,
They
though.
bet, but you can always do the find my password.
Yes.
Yes, we also assist with financial, like I mentioned, assistance, paperwork, and Medicare enrollment because we can help them once they choose. We don't tell them what to choose, but we can
You can.
assist them
Right.
to do it, except for the Medicare supplement plan, which is directly with the private insurance company. We help resolve billing issues. One of the other things that we do a lot of is we have our SMP on fraud and abuse and how to recognize fraud, how to report fraud, and how to assist them with that, with the paperwork. And
So they actually are like eagle eyes to make sure that things are not charged that for work that hasn't been done, things like that. You teach.
exactly. So if they got sent a walker, for example, but didn't
Yeah.
request it,
Or didn't need it.
or didn't need it, and all of a sudden it's being billed to Medicare, then we can assist them with that situation. Um, and then there's appeals and grievances. So when people are getting their bills and they say, oh, I don't recognize that charge, or how come they didn't pay that charge for me? There is an appeals and grievances program or system either through your Medicare Advantage plan or through Original Medicare that needs to be filed, but you can file and get that to be reviewed and hopefully changed.
That's just like a customer service department of a what used to be the large walk-in department stores
Yes.
that now we don't have that many. But it is, and it's a good thing to do because you have the people helping to make sure that things are on the up and up and that nobody takes what they shouldn't.
Yes, and sometimes because the Medicare does have a lot of rules, we're there to help them understand those rules or to fix something that might have help them resolve something that might have happened. I'll give you an example. I had a client who started Medicare and they were still working, so they weren't collecting Social Security because you can be on Medicare and not collect Social Security. Well, you still have to pay the Part B premium. And generally, that would come out of your Social Security payment. But if it doesn't and you're not collecting, you have to pay Medicare directly. Unfortunately, they weren't aware of this. And in 2 months, they got a letter that said, you're being dropped from Part B unless you pay this amount, which then, if you lose your Part B Medicare, you lose your insurance
Right.
through your Medicare Advantage plan. Uh, they did on their own, they did a great job of communicating, keeping copies of their communication, and trying to resolve it on their own. But 9 months later, they still didn't have their insurance or their Part B.
Wow.
So by the time we spoke, because they had kept such
Good
great
records.
records, which is really, really important. I think the most important things are start early. If you're going to get Medicare, start early, and two, keep records. With those records, I was able to contact our Medicare sources and get them reinstated back to their original date without
Wow.
penalty. Yes,
Especially without penalty. That's
exactly, and reinstated in their insurance. But it never ever stops right there. Next month, their when they went back on their insurance, they got a letter saying, well, they had a Part D penalty because you can get a penalty.
yes,
However, we were able to file the paperwork and get that resolved as well.
that's
So
awesome.
it's not just signing up for Medicare. We're with you through
There's
the
the
whole
follow-up.
source of the
And
follow.
the follow-up, oftentimes, it's even more important.
Yes. Yes.
That is phenomenal. I know because I didn't retire until I was 66. So I know what it is to be on Medicare Part A and then have to separately
Get Medicare
get
Part B.
Medicare Part B and pay that every time the statement comes. You go and you make the check out and you send it
Or you go
to
on Medicare.gov and you can set up a payment program. It takes
true,
it right from your bank.
true. But that was, that required going on the internet.
No,
And as techie as I want to be, I just didn't feel like doing that because I figured having the check, that was an extra step that I had. It's just me. That's just
absolutely.
me.
And everyone's different, but we
Exactly.
do show them both of them, how you can mail it in or how you can do it through Medicare.gov as well.
That is awesome. So, say, for example, that I want to be a Shine volunteer.
Mhm.
What do I need to do to sign up? Or do you just because I'm this good looking? They'll say, "Oh, look, Judge Rodriguez, come on in."
Well, we're always looking for new volunteers, Judge
Okay.
Rodriguez, so come on in. So we're going to be starting a new class that will, uh, you need to sign up by April 25th, Friday, April 25th, to register for the class. And then its final in person class will be June 3rd. The rest is done through online modules of training. And so you can contact your local Shine office within the state and say, hey, I want to be a volunteer. And we encourage everyone who to do that.
How do I find the local Shine office here locally?
So the local Shine office here, the easiest way to do it is call the 1-800-96 Elder or the 1-800-963-5337.
So no matter where you are in the state, you call those numbers and they'll get you the specific local area shine.
Yes,
It doesn't matter that you're here in Studio 226 Orlando. You can be anywhere else, say in Miami-Dade, and call that number and they'll give you the shine folks in Miami. But
exactly.
we shine more than they do, don't we?
Everyone
I will
shines the same. We have
see, that's unbiased. Everyone shines the
they
same. That's good.
so our Shine volunteers, some of them have been with us 20 years plus, and they're very knowledgeable and they're from all walks of life. And there's such a strong support system with our Shine volunteers. We mentor, so after the training period, you go through a mentoring period. I'm starting with my new mentee that just ended this last class.
Oh, you should have brought the mentee over.
Well, they're just starting, so and we the then we have a very close-knit group that when we have a question, because you never know all the answers, we'll send an email out and it'll go to our complete group of volunteers
A
who,
listserv.
yes, who have wonderful experience and come back and help guide you through and give you ideas about how to solve that client's problem.
I don't think you'll be surprised at what I'm going to tell you, but back when I was on the bench, I served for 31 years. We had groups, particularly in the juvenile division, where we would go ahead and amongst us judges talk about, I've got this particular problem. Has anybody seen anything like this? We
Exactly.
would share it. And it is the same thing when you're talking about colleagues and professionals. No matter where you are in the state, you might have experienced something that for you is absolutely brand new and just knocks your eyes out of your sockets. But for somebody else, it's run of the mill, and they can walk you through. Um, so it's good because
Yes.
there's been also research that when you work collaboratively, which is what you all are doing, the result it's better. And that is, I think that's a strength that Shine has, that you're able to work collaborative to problem solve. Like you said, you are a problem solver. I get it.
Yeah.
I understand.
Absolutely. And there's so many ways to look at a problem. So getting someone
Sure.
else's viewpoint opens up new doors, and we share information that may be new coming out or changes within the system so that we're alerted to what's happening or going to happen in the future with Medicare. So it's a lot of hands-on experience and it's a lot of support. It's a really great community of volunteers.
You have and you have an incredibly large brain when you put everybody together to come up with a solution. It's
Absolutely.
just phenomenal, phenomenal. You mentioned the importance of educating seniors about Medicare fraud, abuse, and waste. Does Shine incorporate this aspect into its outreach and volunteer services?
It absolutely does. And Medicare fraud's a big
Oh,
business.
yeah.
And for criminals. And it's estimated that Medicare issues billions of dollars, loses billions of dollars each year for Medicare fraud, abuse, and um, errors,
And
just
it just
plain errors.
burns the public up to see that.
It does. So we do have material that we distribute. We do presentations. This robust community outreach focuses on this fraud, abuse, and errors. Here's some examples of some fraud schemes for people to look out for.
Excellent, excellent.
There's the Medicare card scheme. Somebody will call a individual and say, "Hey, there's a new Medicare card coming out with a chip on it and it's plastic. We just need your Medicare number and we'll mail it to you." That's a scam.
No,
There is
no,
no
no,
new
do not
Medicare.
give any number out.
Do not give numbers out. No. You'll receive a card that they're saying, "Oh, we're calling to verify your Medicare number." We won't do that. I mean, when we call and talk to one of our beneficiaries or clients we're working with, they sign an agreement with us that is the client agreement and gives us the ability to discuss HIPAA information. And they know that it's safe because part of the training is also checking us out to make sure that we understand, not only trained in it, but checking out our backgrounds to make sure that
That you're legit.
we can work with this. So we do have that training.
Yeah.
So we may ask for a Medicare number, but that's not until after we've had conversation with our client can and they've agreed that they can do that information.
Excellent. The
Um,
consent has been obtained.
exactly. Another scheme is the hospice services. So all of a sudden you're being enrolled in hospice and without you or your family's permission. So you want to make sure that that doesn't happen. Your Medicare summary
I can
notice.
only imagine if you discover that you have been signed up for hospice and you might not need hospice at that point. What a shock. What a
Right.
scary thing.
And that's when you pick up the phone and call 1-800 um, 96 Elder and say, this is not right.
1-800-96-ELDER.
The your Medicare summary notice that you get in the mail, really important to look at those and your beneficiaries and your benefits statement. That's where you'll catch things to
Exactly.
see if something doesn't look right. So it's really good to look
And
at
then, in
those.
other words, that's where, for example, that walker
Hmm.
would show up, or any blood tests, analyses, um, office visits that were not done would show
Exactly.
up. And that would be your red flag that something is off and something is wrong and somebody needs to know.
Absolutely. That's what you want to do. So you have they're sent to you either by mail. You can opt to have them by email or through they're on your insurance companies. Obviously, if you're on a Medicare
Right.
Advantage plan, or through Medicare.gov. If you are on Medicare.gov, you can review it at any time.
Wow. And that Medicare.gov appears from all utility to be very, very, very comprehensive in terms of what it provides informationally. So we're talking about, again, Shine volunteers.
Yes.
What would you say is the most rewarding part of being a Shine volunteer? And how does it feel to know that you're making a difference, an affirmative difference in someone's life?
This For me, the most rewarding part of being a Shine volunteer is just working with my community and gaining the individual's trust to help them decipher everything and work through it. And you earn that trust by listening and providing solutions to their problems. And it just makes it so much easier for them to make decisions because many of them call and they're upset. They're very nervous about Medicare. And just being able to break it down for them so that they can sit back and look at it and feel that they've made a good decision for themselves is so important.
Well, Elisabeth Hall, volunteer, Shine counselor par excellence. I want to thank you on behalf of all of our listeners and viewers for coming here, taking some time to tell us about something that is absolutely phenomenal and necessary in order to help folks, in order to help folks feel better about the benefits that they have obtained by working hard, paying for their Medicare and Social Security. And folks, what I'd like to request from you now, since those of you listening and watching, is that you subscribe to the channel and that you like. Uh, so you can find also these episodes by going to the website of the Senior Resource Alliance, seniorresourcealliance.org. Join us again next time for another episode of Aging Smarter from Studio 226 in Orlando, Florida. Thank you. And I want to also thank someone without whom this podcast would be impossible. And that is Art Miles, our showrunner, our cameraman, our everything. Today is Friday over here on this side of the of the camera lens. But I will tell you that he is an every day of the week guy. Again, thank you, Art Miles, for allowing us to record this podcast. The information provided in this podcast is for informational purposes only and does not constitute legal advice. You should consult with your attorney to discuss your specific situation.